Substance abuse has plagued the nation for generations. Whether it comes from alcohol, smoking, illicit or prescription drugs, they hold the potential to destroy individuals' lives and social networks. There are also many different sources which these substances abuse can stem from. Some potential sources include school, social pressures, family history, work environment and occupation, and access to substances. To counter this, there are also many different ways in which these individuals can seek support when attempting to curb their addiction and enter a more healthy lifestyle. Many individuals turn to support groups to be surrounded by others that are going through the same experience as they are and can support each other along the way. Additionally, some individuals prefer to follow more directed programs, such as a 12-step program. Choosing which path to recovery is best is a personal choice, but it is important to ensure that these individuals have the ability and access to make that choice. In this discussion, we will talk about societal pressures and stressors, risk factors, structures for support, and accessing resources to build a network. It has been studied and confirmed that the environment that one is in and what they are exposed to have a strong impact on both drug seeking and drug taking behavior. Some of the major sources of influence identified include peer pressure, social reinforcement, imitation, and much more. This study helps to highlight the importance of ensuring that men are surrounded by those who want to see them lead healthy lives and not those that wish to pressure them into taking harmful substances. Additionally, certain employment places individuals at increased risk of substance abuse. For example, approximately 11% of veterans who visited medical facilities run by the VA reported substance abuse. However, the actual percentage is likely much higher. Among those with substance abuse disorder, 80% were related to alcohol, 27% for illegal drugs, and 7% used both. Male veterans are twice as likely to be diagnosed with alcohol use disorder than women. Many of these individuals use substances to cope with other health afflictions such as PTSD or mental health issues. Veterans with a substance use disorder are 3 to 4 times more likely to be diagnosed with PTSD. Veterans are just one subset that faces stressors that lead to substance abuse. Other work environments, those feeling pressure from school or social life, may also be at increased risk. It is important to examine what is impacting these individuals and how their risk can be lowered. There are multiple risk factors that can cause men to fall victim to substance abuse, each with varying levels of severity. Some of the most common include a family history of substance abuse, which can leave an individual predisposed to both the larger addictive nature and familiarity with usage, a history of mental illness, which can lead to self medication, troubled family relationships, childhood trauma or abuse, poverty, and more. Looking at those with a family history of substance abuse specifically, they can be up to 8 times more likely to develop a substance abuse problem than those without a family history. With such an elevated risk, these individuals must carefully monitor themselves and act quickly if signs of addictive nature begin to appear. Additionally, college men are at increased risk of binge drinking due to societal norms of party culture within universities. The frequency of binge drinking is reported to be 30 to 40% among college students, with it likely being much higher. This drinking may stem from a desire to fit in, activities that promote consuming large quantities, using it as a coping method, or using it in tandem with other substances. Regardless of its reason, it has been an epidemic that has been wreaking havoc among college students for decades, and proper action is required if change is to be seen. There have been several successful methods of helping to alleviate the impacts of substance abuse among the male population. One such method is the 12-step model. This model helps to slowly guide the individual from substance abuse to remission. The model begins with having the individual admit that they have an abusive issue and that the substance has control over their life and actions. This acceptance helps them to see that they are no longer in control and able to do what they want, and if they continue down this path, they will never regain that sense of control. The program ends with tasking them to seek out other individuals who are suffering like they were and help them along their own paths to recovery. Another form of support that has shown benefits is programs such as AA meetings. While these meetings are not a treatment for substance abuse, they serve as a source of community and support that former addicts can lean on when in need of help. These groups are crucial when an individual that has gotten clean begins to feel the need to return to substance abuse or is outside pressures leading him to taking it back up. Like with many of the other health afflictions, a solid support system can help individuals tremendously. As previously mentioned, a support network can make all the difference when attempting to leave substance abuse behind. However, finding such support networks is not always easy. Luckily, with the internet, it is now much easier to find such support groups. While support groups have traditionally been in person, and many still are, there's been a shift in moving many of these meetings online, increasing access to a wider population. It also allows for individuals to have a greater degree of privacy while seeking such support. Instead of having to sneak out and potentially lie about where they're going, if an individual does not want someone to know they see a support group, then they can simply take the call from a secluded or private area. Within these social networks, the individuals make deeper connections with a few specific individuals who they can reach out to more often for additional support. This will also allow them to share experiences and begin to relate to each other on a personal level. For more information on substance abuse and support group networks, visit the Men's Health Network website for useful materials.